Hello, my name's Gary Coles, and for those who don't know me, a lot about me, I've been a full-time hypnotherapist for over 20 years, and I've spent over 19 years working in a cancer unit at a major hospital here in the UK, and I was in the first cohort in the UK to be awarded a Master of Science degree in clinical hypnotherapy, and that was for my pioneering research into the use of hypnosis in breast cancer operations. Now, in all this time, having worked with thousands of cancer patients, I know what works, what doesn't. I devise my own techniques, and I've been training doctors, psychologists, surgeons, oncologists, and hypnotherapists all around the world for many years now. And I'm really delighted that after a long, long time, I've been asked to present my course on hypnotic interventions for the cancer journey, Hypno-Oncology, as a pre-conference workshop at HTL. There's been a lot of demand for it. I've had people asking me when I'm going to bring it back to do it in the US. So finally, I am. And I look forward to seeing you there. But I'll tell you some of the things that we're going to be covering in this brilliant 2-day course. Um, Session one, we're going to do an introduction. We're going to look at the available research in hypnosis in the cancer journey and look at all the learning outcomes. We're going to look at ethics worldwide and the law because it's different everywhere. And then we're going to look at 4 very fast technique interventions. You're going to be in situations where people might be having a panic attack because they've just been diagnosed. So we're going to look at least 4 fast technique interventions. We're going to do an overview of cancer. We're going to look at the formation of cancer, differentiation, grading, staging, and progression, because it's all important for you to know to assist with patients going through that journey. We're going to then look at some use of submodalities, which again is a very powerful and important area. We're going to explain all about the use of submodalities with cancer patients and do some demonstrations. And then something that we're going to go over and over again on the course. We're going to do sections on hints, tips, and case studies because I've got loads of case studies, real world things to really enhance what we're going to do. Section two, we're going to look at the likely issues that you might come up against, the sort of sessions that you'll give, the approaches that you'll give in those sessions. We're going to look at communication, both with staff and the patients, because it's very important. Congruency, and pre-talks. Pre-talks is the most important part, in my opinion, of a hypnotherapy session. That's where the real work is done. So we're going to look at pre-talks. I'm going to give you an example of a pre-talk, which moves into a very powerful technique that I use, which is my version of parts therapy. It's unlike any parts therapy that you've come across. It's actually a parts and ego state hybrid, also incorporating NLP, and it's done in a very authoritarian way. And there's lots of good reasons for that, mainly time that you would have in hospital. So I'm going to explain all about that technique. We're going to demonstrate it and teach it so you get to practice it as well until you're confident with it. And we're going to do what I call NLP blueprinting. And again, there'll be explanation, studies, and time for you to practice. And again, hints, tips, and case studies. Then we're going to look at cancer treatment, the different types of treatments people going through the cancer journey will have, and what side effects, though, that are likely to come from those treatments, and how we can work with those going forward. We're going to do a comprehensive introduction to pain, and we're going to look at least 5 pain control techniques, and then more hints, tips, and case studies. We're going to be looking at using inductions and deepeners with cancer patients. We're going to look at scripts. So you've got a whole book of scripts, to about 230 pages of scripts. Oh, sorry, 130 pages. I think there's 250 pages altogether you're going to get of instructions of techniques and scripts and slides and so on. So we're going to look at all the scripts that we've got. We're going to do further pain control. I've got some of my very unique techniques, shimmering barrier techniques, looking at pre-surgical hypnosis, palliative care, psychoneuroimmunology. That's another area that's going to have a profound effect going forward. And we're going to look at its relevance to cancer work and the research behind it. We're going to look at what you should charge and the ethics behind that, further education and research, the future, and looking after you. We're going to talk about the Association of Hypnology Practitioners, and we're also going to cover other areas that I don't normally cover in some of the shorter trainings, and that's working with groups of cancer patients, working with children, working online with patients all around the world, because some around the world, some countries utilize lots of complementary therapies. I mean, America, about 40% of people going through the cancer journey, and 1 in 2 people will go through the cancer journey, will seek out complementary therapy. So that's 20% of the population. That's a huge market. So we're going to look at all that side of things, how you can work with people abroad, all over the world. Because some countries like Australia, for example, statistics show up to 70% of cancer sufferers will seek out complementary therapies. So once you've done this 2-day course, we're going to do it's a serious subject, but we're going to have fun. We're going to have lots of demonstrations. We're going to have lots of case studies. We're going to have lots of practice with each other until you're fully confident to go out and work with cancer patients at all stages of their journey. And people are sought worldwide for this because there are so few people actually being able to offer this to patients around the world. So this is another big another big bow to add to your armory of things that you can work with. So sign up now while it's cheaper, and I look forward to meeting with you and teaching you all about hypno-oncology as a pre-conference workshop at HTL 2026.